Hey everybody, welcome to my messy craft room / office. I am working from home today and I thought maybe you could hang out with me for a couple minutes while I work. I can't unfortunately show you my actual work, but if you're curious as to what I am doing, I am putting together a magazine, and the magazine is for high school students to choose their college. So what I do is I get raw text and images and logos and all that stuff from colleges and universities, and then I design that content into articles in a magazine. Then I make it into a magazine and then that's it. So so not that exciting. I love it. I think it's fun, but I wouldn't say exciting. But I just was feeling like I haven't talked to you guys in a while, and I wanted to do that. And I keep setting you up in my car, and that is just as bad as this. So, I even filmed a bunch of clips for like a day in the life video, and the truth of the matter is I live a very boring life. I love it. It suits me. I am a boring person. But when you try to record it to share with someone, it becomes very apparent just how boring my life really is. So I don't want to subject you to that, but I do also want to say hi and talk about what's going on with my health and my diet and those things that some people are kind of interested in. So this is what you get. This morning I went to the hospital to get an upper GI, which is an x-ray that they take while you're drinking the barium solution. So you drink this chalky milkshake thing. Well, first, they make you drink what they kept calling crystals, and it was just like a fizzy drink, like water mixed with these like Pop Rocks type crystals. They mix it in a little cup, and then you take it all in one little shot, and that expands your stomach out. And I thought it was funny that the girl kept saying, you're gonna feel like you need to burp, but don't burp. Now, have you ever been able to stop a burp? Like, a burp is like a cough, like it's involuntary. It's not like a fart that you can like squeeze your cheeks and hold it in. I mean, it's coming out if it's coming out. Luckily, I did not have to burp. I'm not really a burper. I'm not a good burper. So, it didn't happen. But I just thought it was so funny that she kept saying, like, hold in the burp, hold it in. Like, you could hold it in your mouth, but it's a burp. It's coming. So, so you drink the little fluffy solution, and then you step up onto this, like, little platform up against basically a bed, but it's vertical. So you're standing up against it, and there's like little handles there. And so you could tell that the bed could tilt up and down, but it was just straight up and down. And you sort of climb into it. And then the doctor hands me the little milkshake drink. And first of all, I'd like to say, I didn't like this doctor. He was only, doing this test it was less than 10 minutes, this whole test. But I didn't really like him. Like, walked in the room, and he introduced himself. Well, he said his name, and he walked like right up to me. So he said his name, and I was reaching my hand out, and I said, Shannon, to introduce myself to him. But as I was reaching my hand out and saying my name, he said, where are you from? So then it seemed like my answer to his question was Shannon. And he was like, sorry, what? And then I said the name of my town, but he didn't seem to care at all. I don't know why he asked where I was from. And then he, very briskly tells me to like get into this thing and hold this and put my hand here. And then he says, do you work? I said, yep. Yes. And he said, what do you do? And my short answer is always marketing. I said, marketing. And he's like, what do you market for? And I said, higher education. And he looked at the nurse and he laughed like it was preposterous, like he could not, I don't know, it was really weird. Like, I don't think that's a weird, there's nothing weird about that occupation, right? Like, it's not even interesting. So I didn't like that. I don't know. Nobody likes when people laugh at them. And I did not like being laughed at for just saying what my job was. And I'm very proud to do this job, but whatever. So he does that. Oh, I got a little meeting reminder on my phone, but it has been postponed an hour, so I'm okay. So then he asked me, why are you here? Are you having symptoms? And I'm a good patient. I will tell you whatever a million times, but it annoys me that I went through this whole thing with the nurse. I told her all my symptoms. I told her why I was there, and she wrote it all down. And the short answer is that 85% of patients with mixed connective tissue disease, which I have, end up with some sort of esophageal dysfunction. And that could be reflux, that could be anything with the esophagus. So I could have trouble swallowing, anything. And recently I've had like a new, oh, my dog, so cute. I've had a new cough that kind of came out of nowhere. And the cough, mixed with a couple other little things, made my primary care doctor say, well, let's just check on your esophagus and make sure that you're not having some sort of reflux or something else, because these things go hand in hand. So I explained that to the nurse when she asked me, but obviously, I shouldn't say obviously, but she didn't know what mixed connective tissue disease was, which I don't blame her. So she wrote it down. And so then when it came time for the doctors asking me, I didn't want to explain it all over again. And I already was feeling sort of sheepish because he was just laughing at me and my profession. So I just sort of said, oh, I have a cough. And he like laughed again. He's like, that's it. It's a cough. How long have you had this cough? I said, well, it's been about a month or two. And that's pretty much it. And now that isn't pretty much it, but I didn't want to keep talking to this guy. And he's doing the test anyway. So I'm like, you're not my doctor. Just do the test, see what you see, and then send it over to my doctor. So it wasn't bad at all, and it wasn't like uncomfortable. The test itself was a little bit uncomfortable, only because I have a larger body than a lot of people. So, you're you're standing up against the bed, and then they rotate it. So all of a sudden you're standing to laying, which is kind of fun. And then there's the x-ray part, the x-ray machine, which is up here over you. And it sort of comes down to sandwich you between the bed and this machine. And while you're sandwiched in there, you are repeatedly rotating your body. So lay on your side, flip over, lay on your stomach, lay on your back, lay on your other side, and you're rotating. So I'm trying to rotate whilst in between these two machines, and I didn't really fit. But he just like kept barking these orders at me, so I didn't feel like I could say like, I can't fit. So like my body was in there, but he wanted me to roll over, and my shoulder, it didn't fit. So I'm like super contorted in there, and he's like, okay, turn on your stomach, turn on your back, turn on your stomach. So I was on my side, and he's trying to move the machine, up and down my side, and it literally got stuck on my hip, like on my butt. And he didn't say anything, and I didn't say anything. He's just like, okay, rotate again. I don't know how they could possibly do anyone larger than me. I mean, they obviously have, and there were multiple people in the waiting room who were larger than me, and I kind of gave them a look like, good luck, it's not fun in there. But it was fine. So then at the very end, I don't know if he was really condescending or not, but again, everything gets colored by that first impression. And so he said, you have a tiny bit of reflux. That's all. That's it. Tiny bit of reflux. And I said, okay, that's fine. Just send it to my doctor and we're good. So he made it sound like I had absolutely nothing, like a tiny bit of reflux is normal or something. I don't know. I've never felt heartburn or reflux or anything like that. My boyfriend has really bad heartburn, and he takes medication for it, and it's very noticeable, like the symptoms that he has had. I have never had anything like that. But I'm not surprised by the reflux, because that is, like I said, that does come hand in hand with the MCTD. Oh my God, my dog farted, and it is so strong. You probably saw like a green cloud floating across the screen. Oh my word. She's really old, and she just lets it go. So you gotta admire her. Oh Lord. So, whew. Yep. But good news is I was in and out of there, and then I got an email from my actual doctor already with the results, and it was just a sort of canned response. It said like, got the results of your upper GI, and the results were abnormal. And then it said like, please continue with the treatment that we discussed, which we didn't discuss anything, because like I said, I didn't think I had any sort of reflux, so we didn't really talk about it. But I'll be going to see her on Wednesday. It's Monday now. I'll see her on Wednesday, so I will talk to her then. I have been told never to take antacids with in combination with my one of my lupus medications. So I don't know. I don't know. The reflux, as far as I can tell, does not bother me at all. So I don't know if it's safe to just ignore it, or if it's something that you treat even if it's not bothering you. I don't know. So I don't seem to be getting much work done here. I need to actually do some of this work. So, yeah, I think that's pretty much it with my health stuff. I had my annual physical last week, which is what brought up this reflux thing. But I was on my period, so we couldn't do the pap smear that I was due for. So I need to go back this week. So I'll go back on Wednesday and have that, and also talk about my new reflux problem. No, that's all exciting. Otherwise, I feel pretty good. I do feel like the Benlysta injections are starting to help. I am still hopeful about that they will continue to help, or I will continue to feel as good as I'm feeling now. So that brings me to, let me click on this. That brings me to diet and weight loss stuff. Fun. I have not been doing well. I don't know how to say that. I have been doing well with my diet. I haven't been doing well with weight loss, which is not abnormal for me. I don't know exactly what the problem is, but I have a feeling it's just multiple little things that are preventing me from losing weight. And one of those little things is that I have not been consistent with doing the OMAD, 1 meal a day, on the weekends. I am very consistent with the 1 meal a day during the week, and that's very easy for me, and I really enjoy it. Hi, buddy. Dog number 2. And sorry if that was loud. Just knocked some ribbons off the table. It landed on the dog, and she did not even flinch. So yeah, so during the week, easy peasy, no problem. On the weekends is really the only time that my boyfriend and I get to spend any time together. And like most chunky couples, our favorite way to spend time together is cooking and eating, or going out to eat. And so on the weekends, what we tend to do is we have breakfast together. I make him a big breakfast sandwich, and I'll usually have toast, like avocado toast, and coffee, and then we'll have one more meal. So we'll have maybe Indian buffet for lunch and then skip dinner, or we'll go out grocery shopping and get all the stuff to make for dinner, and we'll have a big dinner. And yeah, and so even though I'm still counting calories on those days, I'm just not getting the benefits of the fasting, and I am still eating more calories than I would if I were fasting. So I think that's hurting me. I think that I've never had my metabolism tested, but my mom has, and I know I'm not my mom, but I'll tell you, we have almost identical everything when it comes to our bodies. So she did have her metabolism tested pretty recently, and it was very low. I think hers was around 1600 or so. And I think that mine is probably similar or lower despite my size. And the thing is, when you do one of those willy-nilly calculators on the internet, most of them say that my BMR is like 22 to 2400 calories, because that is based on my size. Excuse me. But I know for a fact that I have consistently eaten 1800 calories and I gain weight, 1600 calories and I gain weight, 1400 calories and I maintain weight. And even when I eat consistently 1000 calories per day, I usually maintain or lose a little bit. And that's low. Obviously, that's low. Everyone and their mama would tell me, you can't just eat 1000 calories a day. But I should be losing a lot of weight on 1000 calories a day, and I don't. I don't know what that's due to, but it's been years and years and years of me dieting and tracking and all of that to a T, and not losing weight. So I don't know why I was talking about that. I digress. The thing is, at least eating the one meal a day makes it so that I don't gain weight. I may not be losing weight, but I'm not gaining weight, and it's not that I'm happy with that, but it definitely beats the alternative. What do we got here? People posting things to our work chat. It's just dog pictures mostly. So yes, so starting today is Monday, so this past weekend I concocted the plan, but it was a little bit late to enact the plan. So Joel and I did have breakfast and dinner Saturday and Sunday, and today we'll start. I'm gonna do, at least I'm gonna say I'm doing 1 month, 30 days of OMAD every single day through the weekends. And I did warn my boyfriend that was gonna happen, and he always supports anything that I try to do. I just feel bad that it takes that thing away from him, and I don't want to force him to do what I'm doing, because he's fine the way he's doing it. But I need to do it. I need to do it for me. Excuse me. So let me save this file. Okay. Save. So yeah, I'm not really changing much else. I do feel like I am able now to start picking up some more exercise. I have been having some extra trouble with this shoulder. I have multiple tears in the rotator cuff in this shoulder, and sometimes without warning I get a new one, and So this arm is extremely weak right now, and I can't lift it past about here at the shoulder without a lot of pain, so I'm not gonna do it. And that sort of prevents me from doing, a lot of like weightlifting stuff, but I need to just get into doing some walking and cycling and all that kind of jazz, because the weather is better now, and even though I work out inside, I was having a lot of trouble trying to work out in the wintertime because I have very severe Raynaud's, and I couldn't feel my feet and I couldn't feel my hands for about 80% of the day. And not only is that very uncomfortable, but it's also quite reckless to do like a cardio thing where I'm walking when I can't feel my feet. So blah, 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 reasons, excuses. I need to amp up my exercise a little bit, if only to feel a little bit better. So that's that. So any changes to my diet right now are just going to be to button up my weekends and just kind of clean up my weeknights a little bit. I think they've been fine. I do work in a few, maca meats or vegan cheeses here and there, but for the most part, I just have grains and veggies for dinner, and I like it that way. It feels healthy. Calories are pretty low. Easy peas. Save this. What else? Don't have too much coming up this summer. I have one small little mini vacation with my friends. We always go camping. This year we could not get a campsite, and I don't want to talk about it because it really makes me sad, but we decided we should at least still go away, so we are going to a similar location as our camp, but it won't be camping. It's just like an Airbnb cabin in the woods, and that'll be nice. That's in August, and that's all. That's pretty much all. I have been talking to you now for 30 minutes, and I have to assume that no one made it through the 30 minutes. If you did, thank you so much. I hope that you are doing really well, and I appreciate you watching my video and hanging out with me. I'm gonna go try and do some actual work now. I got 2 articles done while we were chatting, so that's pretty good. I will talk to you later. Bye.